at work. Is it supposed to be showing me?
No, you're fine.
Okay.
I'll just take notes that
okay.
you're leading the meeting.
Okay, sure. So we'll go ahead and call the meeting to order. We are meeting today. You all have an agenda in front of you. The first item on the agenda is COVID-19 update. Krista, were you going to provide those?
Yes, I've got a few updates, not much. Essentially, currently, our current number of COVID-19 cases in Iowa is 699. We currently have had one case in Des Moines County. Our surrounding counties currently, Henry County has 6, Van Buren County has 5, and Louisa County now has 1 case. We have opened the Emergency Operations Center last week on Tuesday. It is manned by Gina Harden, the emergency manager, as well as Tammy Shipman, who is the Great River Hospital liaison, and myself. We do weekly calls to do working with the schools, working with long-term care, health with our healthcare partners, as well as we meet weekly with Great River, just really to make sure that we're facilitating any needs our partners, community partners may have, and really making sure that line of communication is open. We've done a lot of education for our partners, and we're there as a resource. So it's set up that we're on a Zoom call, and if anyone of the elected officials or community partners has a need, like our first responders, they log into that Zoom call and let us know. So if it would be a need for there's a need for some PPE, or if they just have a question, or there's just some communication they wanted to have put out to the community, they would log on and give us that information. And then at the end of the day, we do a debriefing with the elected officials. We've been working on things such as emergency housing, which is one of the things that brought us together today, as well as just really implementing some plans to be prepared in case we do have further community spread of COVID-19. Again, we currently only have the 1 case, and so this is more preparation should there be continued spread. And that's really all I have for COVID updates.
Okay. Thank you. Does anybody have any questions for Krista?
No, I don't.
Okay. Agenda item number 2, which is one of the main reasons we're hosting this special meeting, is regarding the declaration for the provision of non-congregate shelters. Krista, would you want to give a background on that information?
Absolutely. So the reason we had to have a declaration for provision of non-congregate shelters was due to Gina Harden, as emergency manager for our county, wanted to apply for the public assistance grants through the FEMA to be able to pay for some of this non-congregate housing. And I'm going to let her kind of talk a little bit more about this before I read the proclamation, and maybe she can give some insight to it as well.
Good afternoon. FEMA Region 7 is requesting this proclamation by the Board of Health in order for us to even consider being able to pay for the hotel rooms for emergency responders, ill individuals, if we have to set up a mobile hospital per se. So this is just one of the first steps for us to do that. So they were looking for a signed official declaration saying that we need this assistance for public health needs. And then we have to provide a justification as to why we think we need it or will need it in the future in our case, because currently we don't need it, but we're just using this as a planning tool to look ahead. So Krista and I have been working on this declaration and trying to make sure it is what FEMA wants from us. We're just trying to look out for the safety of our emergency responders, their families, hospital personnel, medical personnel, et cetera. So we're trying to be ahead of the game, if you will, with this.
Okay.
Does that make sense?
It does. Does anybody have any questions regarding the declaration that's presented to us?
Would this be just for EMS, or are you thinking, like we've already talked about in the office, and designated one person to be in the COVID-19 unit if we do have pediatric patients, and that person would probably not go home? So would that be like a possibility that if you have providers that don't want to potentially expose their family, that they would stay in this housing area?
As far as I know, that is definitely a valid reason and purpose for these shelters, if you will. So I don't know why not.
Okay. So it wouldn't just be if, like, somebody was an EMS provider and positive for COVID-19.
Yeah. Originally, we were looking at more for their family to come stay in the non-congregate shelter so that the ill individual could go home and not expose others.
Right.
And if we could keep the well people in these hotel rooms or however we end up setting this up, they would be less likely to expose others, with our thinking.
Right. Okay. All right. Yep. Sounds good.
All right.
Any other questions?
Are you thinking of a particular motel?
We have actually reached out to several locations, and we have several that have volunteered to do this. I don't know, do we want to give more, we probably don't want to give more detail at this point in time, because we're still finalizing those plans.
Okay.
So what's going to trigger the use of,
Yep, so that's a good question, and part of the proclamation, if you look at which I was getting ready to read this here shortly, but if you read the last paragraph, the last sentence, it says it will be, this declaration once signed by the Des Moines County Board of Health will become effective upon determination by the chair of the Des Moines County Board of Health, the Des Moines County Public Health Director, and Des Moines County Emergency Management Coordinator jointly, that non-congregate sheltering is necessary based upon the number of cases within the area and how many local emergency responders and or families exhibit symptoms of COVID-19. So I think it's based on if we do have more cases and the need arises, and we feel like obviously the 3 persons mentioned in conjunction feel like it's time that we need to open this non-congregate sheltering.
very good, thank you.
You're welcome. Sarah, do you want to...
Krista, do we need... Sorry.
Oh, it's all right, go ahead.
Do we need to read this so it becomes part of the record?
Yes. Do you want me to go ahead and read it, Sarah?
Sure, that'd be great. Thank you.
Absolutely. So, declaration for the provision of non-congregate shelters. Whereas on January 30th, 2020, the World Health Organization designated the novel coronavirus disease 2019 COVID-19 outbreak as a public health emergency of international concern, and on March 11, 2020 characterized the outbreak as a pandemic. And whereas on January 31st, 2020, the United States Secretary of Health and Human Services announced a nationwide public health emergency to respond to COVID-19. And whereas it may be determined non-congregate sheltering may be necessary to protect public health and to lessen or avert the threat of continued community spread. And whereas an urgent health need may arise for non-congregate sheltering for individuals who may need to be isolated or quarantined for 7 days after the onset of symptoms and up to 14 days. Non-congregate sheltering for families with potential exposure to essential personnel who may have come in contact with COVID-19. And whereas sheltering such individuals in congregate settings may further facilitate the spread of disease. endangering the populations that are particularly susceptible to COVID-19 infection, including people over 60 years of age and people with certain underlying health conditions. Now therefore, the Des Moines County Board of Health, under the declaration of the Iowa Public Health Emergency on March 17, 2020, with an extension on March 22nd, March 26th, 6th, and March 31st, 2020, for which certain orders and actions may be necessary to protect the health and safety of Des Moines County and its residents. Exercising the power of the Board of Health to prevent, mitigate, control, and abate the current public health emergency presented by COVID-19 as it becomes necessary. The Des Moines County Board of Health declares non-congregate sheltering may be necessary to address public health needs. Such shelters may be located in hotels, convention centers, and other non-traditional shelter facilities as deemed appropriate by the Des Moines County Emergency Management and/or Public Health. Such shelters shall be under the control of the Des Moines County Emergency Operations Center. This declaration, once signed by the Des Moines County Board of Health, will become effective upon the determination by the Chair of the Des Moines County Board of Health, Des Moines County Public Health Director, and Des Moines County Emergency Management Coordinator jointly that non-congregate sheltering is necessary based upon the number of cases within the area and how many local emergency responders and/or their family members exhibit symptoms of COVID-19. And I would like to stress, this is, again, just one part of our planning phase. We're not anticipating any changes as far as the number of cases in our community. We're only preparing, in case the need arises, that there will be a funding available to support this.
Okay.
Krista,
Yes.
this is Matt. I think I'm identified as caller user number 5.
Hi, Matt.
Hey.
Did anyone have any questions or want me to repeat any part of the declaration for the provision of non-congregate shelters?
No, sounds good.
I'm good with it.
Okay. Is there a motion to support and approve the declaration for the provision of non-congregate shelters?
So moved.
Second?
Second.
Was that Dr. Jackson?
All in favor?
Aye. Aye.
Aye.
Aye.
Should I, Sarah,
Opposed?
since
I'm sorry.
we're on the phone, should I do a roll call?
Oh, sure, good idea.
Approval? Is that all right?
That would be fine.
Okay.
All in favor? Go ahead, Krista.
Matt?
Aye.
Dr. Jackson?
Aye.
Deb Trossel?
Aye.
Anna Short?
Aye.
Beth Heelan?
Aye.
Mary Margaret Wagner?
Aye.
Sarah Goff?
Aye.
Wonderful. Madam
All
Vice
right.
Chair, I have all ayes from the roll call.
Okay. None opposed.
None opposed.
Okay. Any public input?
We have the telephone number available for them to call in. We have the lines open 3 minutes is what we were holding the lines open for, is that correct? So we have the line open for 3 minutes as well as they can, log into this WebEx call. Yes. Log into the WebEx call. Sorry, I had to double check with IT. So I think we have to leave the line open 3 minutes to see if there's any input.
Okay. Are you keeping track at that time?
Yes.
Would you like me to do that? Okay.
That's fine.
Do you have the number handy for that phone? Do you want to go ahead and give the number?
I do. Oh, okay. Yes, the number to call in is 319-753-8203, extension 4. And if anyone cares to email in, they can do so to Poggemiller, POGGEMILLERC @dmcounty.com.
You said 753-82.
8203, extension 4. And I'll check to make sure if there's any emails. And the online's are muted if they want to speak here, because I see some other phone numbers. Do I need to unmute anybody? No, okay. All right, we're coming on the 2.5-minute mark. A little longer. I have 3 minutes.
Okay. No comments from the public at this time.
No, I did not see any. I'll double check the email, but I didn't see any. No, I have nothing in the email either.
Okay. All right. Is there any further discussion? Questions?
No, I don't think so.
Okay. Is there a motion to adjourn the meeting?
Motion to adjourn.
Second.
Okay. All in favor, do you want to do a roll call again?
I can. Matt?
Yes, aye.
Dr. Jackson?
Aye.
Deb Trousel?
Aye.
Anna Goff? Oh, I'm sorry, Anna Short, sorry.
Aye.
Sorry.
Aye.
Jeff Hewland?
Aye.
Mary Margaret?
Aye.
Sarah Goff?
Aye. All right. Opposed? None. Okay, meeting's adjourned.
Thank you, everyone.
You're
Thank
welcome.
you.
Again.